Hey everyone, I'm John Lynn, the founder and chief editor at Healthcare IT Today, and we're excited to bring you another in our series of interviews with top leaders in health IT. And our guest is Hari Prasad. He's CEO at Yosi Health. Welcome, Hari.
Good to be here, John. Thanks for having me.
Yeah, excited for today's discussion. Before we dive into today's topic, tell us a little bit about yourself and Yosi Health.
Sure. So I'm one of the co-founders of Yosi Health, currently also the CEO. Prior to Yosi Health, I spent over a decade working on both the payer side and the provider side. And at Yosi Health, our main mission is to reduce the cost of care for providers and improve patient outcomes.
Nice. So we want to dive into Yosi Health, I think, a bit more in this discussion, but let's start off first talking about the digital front door. We hear it talked about, I hear it talked about every which way, lots of angles. How do you see the digital front door developing?
Mhm. Yes. We've all experienced the waiting rooms, and it's often, the traditional waiting room experience includes us sitting next to other sick patients, trying to complete our intake or check-in process, interacting with the reception or the front desk staff. And there's typically a lot of administrative work that's done in the waiting room prior to a patient's visit. And during COVID, a lot of those waiting room steps and process were displaced. And what we see as the true digital front door is a way where patients are fully engaged well before their appointment. They're able to interact with their staff, the clinic staff. They're able to provide all the information to the doctors. And when they arrive for the appointment, whether it's an in-person appointment or a fully virtual appointment, everything that a patient needs to do has been completed, and that they can use the time to meet with the providers and increase their face time. So that's really what we believe is a true digital front door. Uh, right now, there's a shift that's happening that we're seeing where clinics and care centers and health systems are embracing the idea a lot more than before. And we truly believe doing that will put each of those care centers in the right place where they can provide the most meaningful care to their patients. So a place where everything is fully virtual, and not just a visit, but everything that needs to happen happens in a virtual way where patients are engaged is how we see it evolve.
Interesting. It reminds me of a conversation I had. I just got married a few weeks ago, and my wife said, "How come you have to fill out the papers on a clipboard in the exam room? That's like the worst way to fill it out. I'm just doing it rushed." I'm like, she's a second grade elementary school teacher and knows this is a problem. I mean, nothing against second grade teachers, but like, it doesn't take a healthcare expert to know that this solution should exist, right?
Yeah, first of all, congratulations to you.
Thank you.
Yeah, no, this is a very common problem that the health system faces, because something that you would expect, in this day and age, that we are able to engage with our providers better and remove these administrative bottlenecks, still exists and is slowing us down. And it also leads to a lot of staff burnout, in addition to that poor experience that you talked about. In fact, one of the catalysts for us to start Yosi Health was with my own personal experience, where I went to an ER with a dislocated shoulder. And one of the first things I was made to do was to fill out that clipboard with a dislocated shoulder. Right. So I had
You're
my,
not ambidextrous, so what's
I wish that was one of those times I wish I was, but I was
uh,
not. So I was holding the clipboard, right next to my, thigh. I was, doing the best I can to fill it out. And that's exactly what, is typically the experience for a lot of patients that are sitting in the waiting room having to fill out these forms. So that leads to a lot of clinical information also lost for the providers, because in addition to that poor experience, imagine someone having to fill out all their medical history, while waiting there, sitting next to sick patients. And that information needs to transfer into the medical record systems, which means someone has to transcribe it within the few minutes that's there between the time that you see your providers. So oftentimes, if they don't have that information, they're spending their time documenting all of that information rather than seeing you, the patient, and asking about your health and your needs. So that's where it's not just poor experience, it leads to uh, outcomes not being improved as much as it should.
yeah. What an interesting story. I just interviewed someone about accessibility, and they taught me the principle that there's many of us that are temporarily disabled, which is
Right.
exactly the state you were in, and needed an accessible solution as well. Versus, we think disability and accessibility, and that applies to people that have these chronic disabilities, which is important as well. But he opened my eyes to the idea of a temporary disability, which is often the case in healthcare. So
Mhm.
fascinating. And we all know, I mean, we've seen hundreds of studies that we know that when you fill it out at home, it's better quality info because you can do it with the calm. You can, my favorite visual is, of course, the lady with the purse that has, 20, medications she dumps out to try to fill out that form in the office. Like, what a bad experience. So, anyway,
Exactly.
I think there's a lot of different definitions of digital front door too. So it's interesting. You went to the exam room. I look at others like what one should you go to? Should you go to urgent care, ED? Should you do virtual? So it's interesting how the term I say marketers ruin every term, and they have with digital front door. So it's good to come from that perspective. What do you see as kind of Yosi Health's role in the digital front door? What solutions do you offer when it comes to helping a clinic or health system go digital?
Mhm. Yeah, sure. You're absolutely right that, the term is now more commonly used. Even 3 years back, no one had heard of that term. So we continue to coin new terms every couple of years for
Yeah.
different aspects of care. So the way we see the front door and what Yosi does is it offers a multifaceted set of solutions that allows patients to first and foremost find providers and then be able to access care timely. So what we mean by that is uh, on average, it takes about 6 minutes per patient, sometimes longer, when they have to pick up the phone, call an office, and book their appointment because they're usually on hold. And then when someone gets on the line, you're providing with some basic information about your name, address, etc. So all of that delays care. So we believe access to care should be easy for patients. So we have an online appointment scheduler that allows for patients to be able to book their appointments. And one of the big challenge that care centers face now is because the care that they provide is very unique and tailored to their patient population. If the patients are not aware of what type of appointments or who they should book an appointment with, it can lead to a lot of downstream issues that the care centers are dealing with. So, for example, on your calendar, if I just go and start booking time slots, and if I book a time slot first when you don't have the designated time for me to meet with you, it's going to cause issues and you're then going to have to contact me, reset the appointment, etc. Same with patients, right? So imagine hundreds of patients booking appointments. So that's a major reason why the care centers we talk to often don't make that online scheduler available to patients because of that concern that patients may not know which appointment types they should book. So what Yosi has done is come up with an algorithm that allows all of our care centers to first help match the right patient with the right appointment type with the right provider. So instead of just throwing up a provider schedule for the patients to choose from, we first ask the questions to the patient that allows us to know exactly which provider they should meet with, which appointment types they should meet with. And that has allowed our care centers that we work with create that front door, digital front door, because now their patients are not calling them on the phone, being on hold, looking to book an appointment. So similarly, because our online scheduler is used, we also have a targeted and personalized engagement system in place that uses text and email messages to communicate with patients prior to the appointment. So we believe that's also a very essential part of that full digital experience for patients where they're able to engage with the care center via text messages. They can chat with the staff member. They can reset the appointment if they need to. They can provide all the information that the care center is asking for. So we believe that plays a key role in that digital front door experience. Followed by our flagship product, which is the Yosi intake system that creates that airline check-in experience. It's one of the only times, John, I'm going to use the airline reference because we all know what the experience there is as well, right?
It
So,
can be.
uh,
The
yeah,
check-in's gotten quite good though, I have to admit.
it has. And once they started making the tools available for us to get our boarding pass online and get everything stored on the phone, that significantly improved our airline experience as well, right? I mean, or I should say the airport experience, because we don't
Sure.
have to use the kiosk.
Yeah.
So that's really what we are asking our patients to embrace as well. And when we remove a lot of the traditional barriers, then that creates a fantastic digital front door for patients. Because when you introduce those tools, what good is it if the patients cannot use it? So the key to unlocking the potential of a front door system is to be able to engage patients and get them to use it. And that's really what we've done exceptionally well, where we have removed all those barriers, including asking the patients to download an app or asking them to create their username password that a lot of the EMR portals do. As soon as you introduce that barrier, now the patient is thinking, okay, now I'm extremely busy. I don't have time to go through all of these hoops. So let me just get to the waiting room 5 minutes early and let me just do it there, is how they're thinking. But obviously it never happens because they're on time. They're already waiting for their providers, and now they're stuck with that clipboard.
Hmm.
So instead, what Yosi has done is to understand what the consumer experience that the patients are demanding. And we've designed our intake system and all of our tools to deliver the kind of experience that patients are looking for. And by doing that, what we've done is to increase the usage, increase the adoption of our products with our patients. And now that delivers a fantastic return on investment to our care centers. So that's why we believe a digital front door is not just a fancy term that people use that, now has these bells and whistles that's offered, but it's a strategy that's crafted in a meaningful way that not only recognizes who the patient is, but engaging them in a very thoughtful way to get them to do everything we need them to.
Yeah. I want to dive into some of those things, but before I go there, the self-scheduling is such an interesting thing that there was so much fear going into, can we allow them to self-schedule, right? And I'd love to hear, how that's evolved, and what is that fear dissipating? But also, what I heard from most people over the years was we would start with a little block of time they could self-schedule. Are you still seeing that where they're like, let's baby step before we throw the full schedule at it? Is that still the best practice and the strategy, or has your, I would describe it almost as a chatbot scheduler, right? Is this, the questions and the algorithms you've created been enough where you can start off, with a larger portion of the schedule or the full schedule? What are you seeing in that regard? Because before it was like, okay, let me give you 2 hours in the afternoon for self-scheduling. The rest I want to control. What's been your experience?
Yeah, sure. You're absolutely correct, John. The fear still exists because the challenge with making a provider schedule available to patients is that the call center staff that helps with scheduling appointments, they're well trained to ask all the right questions to the patients so they know which appointment to book.
Right.
That's the part that's harder to replicate. So that's why, without that component available, they're very reticent to offering, these online tools to the patients because of the fear of patients booking incorrect appointments. So we still have some providers that have the blocks, used for online scheduling. But what Yosi has done well is to remove that fear by working with each of our care centers and understanding how is that they actually are able to book those appointments when the patients call. So we were able to replicate their business needs, their workflow needs, and matching the right patient with the right provider, thereby removing the concern for our customers. So almost, all of our customers today, John, are fully making all of their provider schedules available to patients. So we're seeing a shift from, Tuesday afternoon 3 to 5 or Thursday morning from 9 to 11, changing to our customers using Yosi's system that's fully bidirectionally integrated with EMRs. Why that's important is because we're able to read in real time providers availability, because one of the limitations that exist in the market is the integration is not near real time, which means I'm able to, companies tend to interact with the EMRs every hour or every 30 minutes or every 15 minutes. So they have this scheduler that starts reading and writing information back and forth. So if I do that, then I'm never displaying provider appointments in real time. So then that causes a significant gap. So these are the foundational things that Yosi has removed by first and foremost connecting our system to EMRs in real time. So at any given time, I'm able to show the list of available appointments to patients in real time. Two, by engaging with our customers and understanding what their needs are, we're able to replicate those algorithms for the patients to book the right appointments with their providers. And when we do that, they see a tremendous value in maximizing their provider schedule and availability while significantly reducing the burden for their staff. And that's really what we are most focused on, and how can we provide access to care for patients timely so that they're able to book these appointments as quickly as they can.
So let's talk more about that EHR integration. You talked about a bidirectional. Is that available for all the EHRs? I mean, obviously you're limited by what the EHR makes available. And it's interesting, you have a lot of integration points. You have the online self-scheduling, you have the reminder system that you could update in the EHR, you have the forms, right? Your flagship product, filling out all the forms and the intake data. You're integrating all three of those, and and it sounds like deep integration is key to what your approach.
Mhm. Yes, absolutely, John. So in terms of what services and value that Yosi provides to our customers, a deep bidirectional integration with EHR is critical for them to get the value that Yosi provides. So in addition to those three front door things, we also handle patient payments, where we're able to help patients transact with their credit cards and pay their co-pays or outstanding balances prior to and during their visits or after the visit. So that's also a key part of our digital front door strategy. And for all of these, we need information to be transferred real time, and we need to be able to read and write patient information. So what we've seen over the last number of years is also a significant shift in how the EMRs are thinking about enabling or providing access to companies like Yosi Health so we can serve their customers better. So one of the questions I often get asked is, as a founder, are you concerned about EMRs doing all of the things that Yosi does? It's a fair question, right? Because you would expect an EMR to deliver the type of solutions and services that Yosi provides. Sure. So while it's something that we pay a lot of attention to, the type of engagement and automation that each of our clients' needs are so complex and diverse and significantly vast that EMRs are not quite equipped to deliver that kind of automation and customization to their customers. That's where Yosi plays a key role in providing that solution to their customers. For example, we work with a large number of pediatric care centers, and oftentimes they could potentially have more than 300 different workflows, even if it's a single physician pediatric office, because the child may be of different age and stage. So as a result, they might need to have different vaccine sheets provided to the parent. They might have to provide different, screeners and assessments to the parents based on the age of the child. And that's just one example of, one specialty. And imagine now an EMR having to need to do that for each of their customer base and for all the specialties that they serve. So that's why it's a massive, problem, and it's deceptively complex, creating that level of engagement. So that's where Yosi excels in delivering that type of customizable solutions to our customers that matches their workflow needs. And for that, we collaborate closely with the EMRs, and we've now been leveraging thousands of these APIs that's available with most of the major EMR solutions. And we see that continuing to improve, and we see that getting better, because with some EMRs, we're still only able to push a PDF document, which in the truest sense is not really an integration. It's just transferring a document. Whereas in some cases, we're able to push patients' review of systems data, clinical questionnaires, history of present illness, etc., thereby truly creating that efficiencies that we are after. So each of the EMRs are in sort of different phases of their own evolution of making those integrations available to vendors like Yosi.
Interesting. I think the other thing that's interesting about your product is you kind of have two customers. You have the patients on one side that are impacted, and you also have, the staff that would normally hand them the clipboard. So talk to us about that, maybe some stories or experiences from both the patient sides using your product and what they experience. And I guess the other question around staff is, are they ready for this type of, to embrace this type of digital front door?
Mhm. Yeah, sure. So before I share some of those experiences, one thing that we love here at Yosi is some of our patients that ended up using Yosi happened to be administrators and staff members at care centers
Uh-huh.
who actually reached out to us and they said, "Listen, we used Yosi as a patient. I used it as a patient. I would like to introduce this and bring it into our clinic."
Yeah,
Which
what a great endorsement. I love that.
exactly that our patients are now our ambassadors and they're actually bringing the change within their own care centers.
Hmm.
So you're absolutely correct. Yosi serves two types of customers, both the clinics and the care centers, and also the patients. And we take that very, very seriously because we believe the reason for our success and why and how we will continue to be successful is in getting patients to use our products and services. If they don't use it, no matter what you do, no matter how cool your services and solutions are, it's never going to deliver the value to our customers. So
Mhm.
patients are our champions. We designed everything around driving adoption with our patients. So that's why, as I mentioned, we keep their experience very simple. We're also continuing to focus on how can we create a very hyper personalized experience for the patient, which means we know exactly who the patient is, what their needs are, and we can get the right set of information from the patient at the right time. So that's how we think of hyper personalization. So while doing that, we also stay laser focused on delivering the experience that our customers need to have, whether it's the staff or the providers. And they're often, very busy with a lot of things going on. So now this is why I greatly appreciate your question, because now you're adding another software solution on top of their overburdened workload. So it is very tricky. And that's why we recognized it. And we said, all of our integration with your EMR will make it real time and we will have all of the information available there. So you can access all of it automatically from the EHR system or the EMR system, which means now we have our staff, staff members at the customer sites very pleased with our approach because now they don't have to have multiple dashboards. To you and me, it might seem a simple thing. I do have 1,000 windows open on my computer, but I'm not on the front lines providing care. So so we appreciated, how serious their job is and how we need to make it as easy as possible. So that's why our interface is, direct with the EMRs. The other things that we recognized, one is every single clinic is unique. And as they say in healthcare, if you've spoken to one clinic, you've spoken to one clinic. So we appreciate the nuances in the workflows that they have. And we created a system that can match their existing workflows. Because when you do half of it or most of it, then they still need to do the additional work to collect certain information if your system cannot collect it. It's not ideal. So that's why we allow them to fully customize everything that their needs are. And lastly, we believe in creating a patient experience that's consistent with where they're receiving care. Our patients often don't even know that we exist. We're okay with that. Our marketing team is not happy with it, but we believe, that's the best and ideal way to engage patients in a fully branded, white labeled way, where patients can engage with their providers. They can two-way text with their patients, with their doctors if they need to. So we have an asynchronous real-time two-way chatting where they can start interacting with the patients as they're engaging with our products. So all of these are how we think about creating and delivering a great staff and patient experience, because to us, both of that is paramount to our current success and our ongoing success.
Wow. So talk about is what's next for Yosi Health? What do you see on the horizon?
Yeah, sure. So we are very fortunate to be at the place where we're interacting with patients at the earliest time that they're seeking care. So we're fortunate, and we are very grateful that we are now providing solutions that delivers the experience downstream for the patient. So as a result, we could look at a wide range of things that we could be doing to support both our patients and our staff. And because of that, we also try to stay very disciplined to not get distracted, because it's always easy to go after the next shiny object. So what we are doing now is focusing on that patient experience and how can we continue to get more engagement and utilization from our patients. And for that, we need to learn from what we've been doing. So there's a lot of effort within Yosi to find ways where we can maximize the adoption for our patients. So that's one of the focus groups that we have within Yosi, whose primary responsibility is finding out all of the touch points that we have with our patients and how can we, improve that, increase that. While at the same time, we're also looking at our primary segment, John, which includes specialties like pediatrics, orthopedics, behavioral health, and OBGYN clinics, in finding out how can we understand the voice of customer better, how can we understand more of their pain points, that Yosi can now create solutions that are tailored for each of those specialties that we serve. So that's the second focus area that we have. And third is just looking at the adjacent spaces that Yosi operates, both upstream and downstream, to find out how can we provide more value add to our customers. Because fragmentation is, a reality. It's a major pain point for our customers, and they have multiple point solutions for different, aspects of their pain points that they solve for. So we're also looking at finding out ways where Yosi, because of where it operates at the forefront of that patient engagement, can also add more services that will allow them to consolidate their vendors. And for that, we are grateful that our customers, share their, feedback with us. They, spend time with us. They meet with us to say, these are the other pain points. And that's allowed us to craft a strategy for the next 18 to 24 months that will allow us to then move into some of those aspects to address more pain points for our customers.
Excellent. Well, Hari, I appreciate you taking time to talk about the digital front door and share more about Yosi Health. I learned a lot from you, and I think our audience will really enjoy your perspective. So thanks a lot. And thanks everyone for watching and listening. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com or search for Healthcare IT Today on your favorite podcasting applications. Thanks, Hari.
Yes, thank you for having me, John.